Okay, we're going to move on now to passive movements of the wrist and hand. So in terms of being a therapist, for the actives you can very much sit opposite your patient. In this situation you won't see it on camera, but I'm mostly going to be standing up. The purpose of that is that if I'm sat down, what you tend to do is you get this really awkward handling position as you're trying to come to the extremes of range. Whereas if I stand up, I can then move my body round and I have much more control of my arms and hand to apply the pressure to the patient. So please bear that in mind, that you would be standing up to enable yourself that free mobility whilst you're applying the pressure. So we're going to start off with the wrist, and we're going to look at the radiocarpal joint for flexion and extension. So if we do it on this side first of all, so I'm standing up and I'm coming into position here, so we're going to need to fix the radius and ulnar distally, not coming too close. If we get too close to the joint, then either our fingers here are going to get in the way as we come into extension, or the same thing is going to happen on the other side, our thumb's going to get in the way. So don't go too close to the joint, just leave a slight space in between, then make sure you fix nice and firm. Then with your other hand we're going to come over the top, and most of the pressure is going to come through the index finger and the thumb on the other side, rather than pressure from our little finger, because it's too far away and going through too many joints. So in this position here, what we're going to do is we're going to take it into extension first of all, just into there. So you can see I've just got enough gap between this hand and this hand to take it into full end of range extension, and then we can take it through into full passive flexion. Again, applying pressure as much as I can towards the joint, and then away into extension. Okay, obviously checking for pain throughout that movement. Next we're going to do radial and ulnar deviation. So for the purpose of this we're going to have the palm facing downwards. Same sort of principle, not too close to the joint, but fixing the radius and ulnar, and then coming on top, again nice and close, in as close as you can to the carpals on the carpal row here. So what we're going to do is we're going to deviate away, which is towards the ulnar side, so it's ulnar deviation, towards the radius, so radial deviation, back again towards the ulnar, back towards the radius. Okay, so my pressure is through here, not through here. Okay. Moving on to the thumb, so for flexion extension of the thumb, so if we turn our hand over this way, so now when you're applying the pressure here, what you've got to bear in mind is you haven't got just a single joint that you're really looking at, because you're actually looking to assess all of them throughout the range. So therefore you have to progressively work your way through the joints for the flexion and extension. So from here what we're going to do, so you're going to need to use your handling to try and work to your advantage. Okay, so we're going to take the hand, we're going to take them into extension. So I'm applying initially the pressure at this end, yes, at the proximal end into extension. So we've got extension of the first CMC here, and then I can add on some pressure a little bit further down, so that we're working further towards the end of the thumb. Then we're going to come across into flexion, so that's full range flexion of the CMC, and now come on to the end of the thumb to show full range of the interphalangeal joint. Just for clarity, we'll go on the other side as well. Okay, so we're trying to apply a pressure here and then apply pressure here. Okay, so we're going to take away and then away, and then back across into flexion, and then we need to add on this flexion in here. So we've got flexion there first of all, and now flexion in here. So because we're trying to differentiate where the problem may lie in terms of where their pain is. So if you get pain in this range, then you know this is where the problem is, and they'll probably tell you as well that's where the pain is. Whereas if you're applying a pressure here and they say they've got the pain, then you'll either identify it here or here. Okay, abduction and adduction. Okay, now all the abduction is happening at this joint, so we don't need to worry too much about what's happening here. So now we can come a little bit closer, so don't push from the end of the thumb, come closer to the joint that we want to work on. And we're going to take it up into abduction, down and compress into adduction, and then up again into abduction, back down, adduction. So I'm working here on the metacarpal, that's where I'm applying my pressure. Okay, opposition, so we're going to work on the other side, just for the purposes of the camera. So what we're going to do here is we're going to move the thumb through its entire arc. You're not going to get the same sort of feeling of that passive overpressure quite as clearly as you would in, say, something like the wrist or the elbow, because it's such a delicate and intricate area. But what we're going to do is we're going to take this thumb and we're going to follow the arc and take it towards the finger and then back again. So we're feeling for how much mobility we have towards each of the fingers. Don't worry about trying to touch the tip there. It's the motion towards that finger and back again. And then, sorry, my hand's going to have to come round here just so we can see. And then towards and back again. Normally this hand would have been on top here. I'm just trying to make it so you can see. Okay, next up we've got the finger flexion and extension. So again what we have is flexion at the metacarpophalangeal and then the proximal and distal interphalangeal. For the purposes of this one, what we're going to do now is we're going to break it down. So we're going to work at the metacarpophalangeal first, and then we'll deal with these afterwards. Okay? We're going to work on them as a group. If you were to identify an individual knuckle that had a problem, you can then isolate and palpate that. For the purposes of your assessment though, we're happy with you just assessing them all as a group. Okay? What we're going to do is we're going to fix here at the metacarpals. We're then going to take the first row of phalanges, we're going to take them into extension and then take them through into flexion, just applying my pressure here on those phalanges and back again into extension and then relax. And now we can deal with the next set. Okay, now because obviously the little finger that much shorter, we're just going to deal with these three together. So again we're going to take them from there into extension and then into flexion, back into extension, and then again here taking this row into extension, flexion and extension. And then we can also deal with the little finger just here. So we're going to take it up into flexion, extension and flexion again, and then the distal, extension, flexion and extension. Obviously with this type of handling you could do that at each individual finger. For the purposes of the assessment, if we asked you for just finger flexion, then you could do them grouped. Okay. The last one we need to have is abduction and adduction, so the hand facing downwards. Now obviously again we're only going to work here on the metacarpophalangeal joints, and we need to look at the abduction and adduction range. Now typically what we're actually going to do is we're going to work from this finger here, okay, so our third digit, and we're going to work outwards from there. So the fingers need to come together. So this is end of range adduction, and then we're going to take the little finger out, and then the next finger out, and then the index finger out. Okay, we'll just do that on the other hand as well, just for clarity. So all of the fingers together, and then take the, I'm just putting my hand down so you can see, but typically you would hold it this way. I'm just trying to lower my fingers down. Little finger out, and then the next finger out, and then the index finger out. So you can see here how we've got full separation between each of the fingers, and then back and close them back up again. So that's full range abduction and adduction. And that concludes the passive range of movement for the wrist and hand.